Before you do anything else this morning, before the coffee, before checking your phone, before you even think about what the day looks like, notice what your body is already doing. You're clearing your throat. Maybe you already did it twice since you woke up. Maybe there's that familiar thickness sitting right at the back of your mouth, that coating you can't quite swallow away, that low rumble in your chest that turns into a cough before you've even stood up. Your voice sounds rough. There's something that tastes faintly off. And somewhere in the back of your mind, you're already thinking, allergies again. But here's what I need you to consider this morning. What if it isn't? What if the thing you've been treating for years, the sprays, the antihistamines, the neti pots, the steam showers, all of it, what if that's been treating the wrong problem? And what if the real cause has been happening inside your body every single night, completely invisible while you sleep? Because in millions of people over 60, that's exactly what's going on. And almost nobody talks about it clearly. My name is Dr. James Carter. I've spent more than 2 decades working with patients who deal with chronic throat symptoms, morning mucus, persistent throat clearing, that relentless sensation of something that won't go away. What I want to share with you today changed the way I think about this problem entirely. Not because it's complicated, because it's actually simpler than anyone has explained. Your body has been sending you a signal every single morning, and today you're finally going to understand what it's saying. If this is the kind of content you've been looking for, real explanations, not just quick fixes, subscribe to this channel right now. We cover this every week, and you won't want to miss what comes next. Most people who deal with morning mucus have been through the same cycle. It starts with an assumption. Must be allergies, must be the season, must be the dust in the bedroom. So they try something, a nasal spray, an antihistamine, an air purifier, and it helps, a little, for a while. But then it comes back, every morning, almost like clockwork. That thickness in the throat, that need to clear it before you can speak properly. And eventually, most people stop looking for answers. They decide this is just how their body works now, just part of getting older. I want you to hear this clearly. That conclusion is wrong, because what you feel every morning isn't random. For a very large number of people, especially those over 60, it has nothing to do with allergies at all. It has to do with what's happening inside your body during the hours you can't see. And once you understand the actual mechanism, the changes that make a real difference are not complicated. They require understanding, and that's exactly what I'm going to give you today. And it's costing you more than you realize, because the real problem keeps going, night after night, quietly, building. While you sleep, completely still, completely unaware, trusting your body to rest, something else is happening in the background, something your body is actually trying to fight. And by the time you wake up, the evidence of that fight is already sitting at the back of your throat, waiting for you before you've even opened your eyes. The worst part, most people spend years, sometimes decades, treating a symptom that isn't even connected to the real cause, and the real cause continues, undisturbed, getting quietly worse with each passing year. But here's the other side of that. Once you understand the actual mechanism, once you can see clearly what's happening and why, the changes that make a real difference are not complicated. They don't require expensive treatments or dramatic lifestyle overhauls. They require understanding. And that's exactly what I'm going to give you today. Stay with me, because what comes next explains everything. Let's start with what you've already tried, because you haven't ignored this. You've done what any reasonable person would do, noticed a problem, looked for solutions, and tried them. Nasal sprays, antihistamines, air purifiers, allergy tests, and still, every morning, that mucus. I see this constantly in my practice. Patients who have spent years managing morning throat symptoms under the assumption that allergies are the root cause. And here's what's important to understand. Allergies are real. These aren't bad treatments. They're just the wrong treatments, when the cause is something different entirely. True allergic reactions follow patterns. They worsen during pollen season. They flare around cats, or freshly cut grass, or disturbed dust. They respond, at least partially, to allergy medication. But when mucus appears every single morning, predictably, consistently, almost before you've had time to fully wake up, that pattern is telling you something completely different. The medical term most people have never heard is laryngopharyngeal reflux. Doctors call it LPR. You may have heard of acid reflux, that burning in the chest after eating. But laryngopharyngeal reflux is different in one very specific way that makes it so easy to miss. There is no heartburn. Research published through the Mayo Clinic and reviewed by the American Academy of Otolaryngology has confirmed that a significant portion of people with LPR never experience the chest burning most people associate with reflux at all. The acid reaches the throat, the larynx, the vocal cords, the back of the mouth, without triggering any sensation in the chest. So the person wakes up with mucus, a rough voice, the need to clear their throat, and thinks, allergies. They never think reflux, because they've never had heartburn. Now picture something. Imagine leaving a window open on a cold, damp night. Slowly, over 8 hours, cold air drifts into the room, quietly, steadily. By morning, the room is colder than it should be. You felt nothing while it happened. But the evidence is undeniable when you wake up. That's what happens in the throat during silent reflux. When you lie down to sleep, the valve at the top of your stomach is supposed to stay closed, keeping stomach contents where they belong. But this valve weakens with age, with certain foods, with certain medications. And when it doesn't close completely, small amounts of stomach acid and digestive enzymes can drift upward and reach the throat. Not enough to cause pain, not enough to wake you up, just enough, over a full night of sleep, to irritate the delicate lining of the larynx and inflame the tissue at the back of the throat. And your body's response to that irritation is immediate and automatic. It produces mucus, because that's what your body does when it detects a threat to vulnerable tissue. It sends a protective coating, a shield, to cover the area under attack. The mucus isn't the problem. The mucus is the response to the problem. Your body isn't malfunctioning, it's trying to protect you. But as long as the irritation continues every night, the mucus production continues every morning. Treating the mucus directly, with sprays, antihistamines, steam, is like mopping the floor while the faucet is still running. The source keeps going. And there's something even more important coming, because silent reflux is only part of the story. Here's where it gets more interesting. Because for many people over 60, silent reflux isn't working alone. There's a second mechanism, and when it combines with the first, the morning mucus becomes almost impossible to shake with conventional treatments. This second factor is something almost no one connects to throat symptoms, and it has to do with how your body breathes while you sleep. After 60, several things change simultaneously. The muscles at the back of the throat relax more during sleep, increasing mouth breathing. Nasal congestion, from seasonal changes, structural shifts in the nasal passages, or simple aging, pushes the body toward breathing through the mouth instead of the nose. Certain blood pressure medications, diuretics, and even antihistamines reduce saliva production, and saliva is one of the throat's primary protective systems. It neutralizes acid, keeps membranes hydrated, and maintains the natural barrier shielding the larynx from irritation. When mouth breathing increases and saliva decreases, the throat dries out during sleep. Research from the Journal of Clinical Sleep Medicine has documented the link between nocturnal mouth breathing and chronic airway inflammation. The National Institute on Aging has tracked how saliva production decreases progressively with age and with common medications taken by adults over 60. The result is a throat being attacked from two directions simultaneously. Acid from below, dryness from above. And the body responds to both threats the same way. More mucus, every night, while you sleep. Let me tell you about a patient I'll call Robert, 68 years old. 6 years of clearing his throat every single morning. 2 allergists, allergy tests, air purifiers, hypoallergenic bedding, daily antihistamines. The mucus never stopped. When he described his routine, several things stood out immediately. Dinner around 8:30, bed at 10, completely flat. First thing in the morning, strong coffee on an empty stomach. And he snored, meaning significant portions of every night were spent breathing through his mouth. No heartburn. Reflux had never crossed his mind. What was happening to Robert was this: a late meal, a completely flat position, an aging valve between stomach and esophagus, all combining to allow small amounts of acid to drift upward every night and reach the larynx. At the same time, mouth breathing was drying out the very membranes that would normally provide protection. And morning coffee on an empty stomach was stimulating additional acid before his throat had any chance to recover. His body was producing mucus every night because it was genuinely under threat every night. The changes we made were not dramatic. Eating dinner at least 3 hours before lying down, slightly elevating the head of the bed, addressing the nasal congestion driving the mouth breathing, better hydration through the evening, waiting at least 30 minutes after waking before coffee, with something small to eat first. Within 3 weeks, the morning throat clearing had dropped to a fraction of what it had been. Within 2 months, he described his mornings as feeling, for the first time in years, almost normal. Robert's story isn't unusual. It's what happens when you treat the right problem. Before I walk you through everything you can start applying tonight, I want to speak to you directly. If you've made it this far, you recognized yourself somewhere in what I described, and that recognition matters. The people who make real progress aren't the ones who wait until things force their hand. They're the ones who act while they still have full control. If you want structured, step-by-step guidance on protecting your throat health and sleep quality after 60, the program I've put together covers every mechanism and every strategy in depth. Find it through the link in the description, the pinned comment, or scan the QR code on your screen right now. The next step is yours. Let's talk about what actually works. And more importantly, why it works. Because understanding the mechanism is what makes the difference between following a list of tips and genuinely changing the pattern. The first and most impactful change most people can make has nothing to do with medication. It has to do with gravity. When you sleep completely flat, you remove the one physical force that helps keep stomach contents in place. Elevating the head of the bed, not with a stack of pillows that bends the neck, but by raising the head of the mattress 4 to 6 inches, keeps the esophagus working with gravity instead of against it. Studies from the Cleveland Clinic have shown that even a modest elevation significantly reduces the frequency of nighttime acid exposure in the throat. This one change alone produces measurable results for many people within the first week. The second change is timing. Your stomach takes between 2 and 4 hours to significantly reduce its acid load after a full meal. Eating your last substantial meal at least 3 hours before lying down gives your digestive system time to work while gravity is still helping. This is one of the most consistent recommendations in the Mayo Clinic's published guidelines on laryngopharyngeal reflux, and it's one of the simplest to implement starting tonight. The mouth breathing piece is one most people never connect to throat symptoms. When nasal congestion pushes the body toward breathing through the mouth during sleep, air passes through raw, dry, and unfiltered for 8 hours straight. Over time, this dries out the throat tissue directly. A simple saline nasal rinse before bed, or addressing congestion with your doctor's guidance, allows the nose to resume its natural role as the airway's humidifier. Many patients find this single change reduces morning dryness significantly within days. Coffee deserves its own mention. Caffeine stimulates acid production. When the first thing consumed in the morning is strong coffee on an empty stomach, before the throat has had time to recover, you are introducing a powerful acid stimulant into a system that's already been working for 8 hours. This doesn't mean eliminating coffee. It means giving the body 30 minutes, having something small to eat first, and letting the overnight recovery complete before challenging it again. Many patients who make only this change report noticeable improvement within 2 weeks. You're still here, and I want you to understand what that means. Most people watch the first few minutes of a video like this, feel a flicker of recognition, and drift away before anything changes. You stayed. You processed what your body has been trying to communicate, possibly for years. And the gap between knowing and actually doing something is exactly where most people get stuck indefinitely. I've watched patients choose between 2 versions of their mornings. One starts with throat clearing, a rough voice, and the quiet resignation of another day managed rather than lived. The other starts differently, less demanding, lighter, the throat less insistent before the day has even begun. The program I've developed, built from more than 2 decades of working directly with patients dealing with exactly this, covers every mechanism in depth: sleep positioning, dietary timing, airway hydration, nasal health, the full system. You can access it through the link in the description, the pinned comment at the top of this video, or by scanning the QR code visible on your screen right now. Both paths go to the same place. What you do with this moment is your decision. If this video helped you see your morning symptoms differently, hit the like button right now. Subscribe to this channel if you haven't already. We go this deep every single week. And leave a comment below. How many years have you been clearing your throat every morning without knowing the real reason? I read every response. Here's what I want you to take away from everything we've covered today. Your body has not been failing you. It has been communicating with you. Every morning, your throat has been delivering a message that most people spend years misreading. Not because they aren't paying attention, but because no one ever gave them the right framework to understand what they were hearing. The mucus isn't the enemy. It never was. It's a signal. It's your body's way of saying something happened last night, something irritated tissue that needed protecting. And I responded the only way I know how, with everything I had, quietly, while you slept. The problem was never the response. The problem was the trigger. And the trigger, for most people, has been hiding in plain sight inside their nightly routine. Silent reflux without heartburn, a valve that weakens gradually with age and diet and medication, acid drifting upward while the body is horizontal and unguarded, mouth breathing drying out the very membranes designed to provide protection, morning coffee flooding an already stressed system before it's had any chance to recover. These aren't mysterious forces. They aren't permanent sentences. They are patterns, and patterns once understood can be changed. Think about what it would feel like to wake up tomorrow and not spend the first 10 minutes fighting your own throat. To speak your first words of the day without the roughness that's been there so long, you stopped noticing when it arrived. That version of your morning is not out of reach. It isn't a promise of perfection, but it is available, through changes simpler than most people expect, applied consistently, built on understanding rather than guesswork. The research from the Cleveland Clinic, the Mayo Clinic, the American Academy of Otolaryngology, all points in the same direction. When you address the actual mechanism, real and measurable change becomes possible. Not overnight, but within weeks, gradually, in ways you can feel. Your body has been trying to tell you something every single morning. Now you finally know what it's been saying. And if you're dealing with symptoms that have been persistent, severe, or getting progressively worse, hoarseness that doesn't resolve through the day, difficulty swallowing, the sensation of something chronically stuck, please see your doctor. These symptoms warrant a proper evaluation. Understanding the mechanism is valuable. Professional assessment is still irreplaceable. Take what you learned today, start with one change tonight. Elevate the bed, move dinner earlier, do the nasal rinse, pick the one that fits where you are right now, and begin there. Because the mornings you have from here are still being decided, and the fact that you're still watching this tells me something important about you. You are not someone who is willing to simply accept a lesser version of your own days. Share this video with someone you know who starts every morning the same way, clearing their throat, reaching for something to help, wondering why nothing quite works. That person deserves to hear this. You know exactly who they are. Subscribe to this channel if you haven't yet, because next week we go even deeper into what happens to your sleep quality, your breathing, and your energy levels after 60, and what the research now says you can do about it. You don't want to miss that conversation. This is your health. These are your mornings. And now, for the first time, you understand them.